So what'd you think of CNO3?
Well, you know, this is my second time here.
Yeah, I thought so.
Yeah, that's right. And, you know, you look back at all your education and what you learn in school and what you gain going to continuing education courses on a weekend basis. Yeah. They're great, hard to bring back in a lot of cases too. Make it a reality in your practice. Yeah. This is the best education program ever because it teaches us what we really never learned in dental school. Yeah. Okay, you bring in, CNO has brought in people like Dr. Zebovitz, Dr. Piper, several physicians that have been instrumental in teaching us MRIs, and the knowledge level that you gain, you take back with you. Because this is what we do. It applies to everyday dentistry.
It's everything that we do.
Right. I don't care if it's perio, I don't care if it's endo, I don't care if it's implant therapy, I don't care if it's restorative dentistry. What we do needs to involve the joint. Yeah. And CNO is the joint.
All things measured though.
Everything.
Yeah,
everything's measured.
The orthopedic end of it, the neurology behind it. You know, there's gadgetry out there that lets us do things we couldn't do 10 years ago.
Technology. And Robert Kerstein, who's tried for 30 years to make it, you know, a mainstream in dentistry, and it's just everything. Yep. So, and this brings it all together. We bring all these great specialists together that are willing to share.
Yep. And work together and not bicker at one another. Right?
Yeah. Well, and most importantly, I think, you take it away, and then you take it to your office, and you share the passion. Yep. And that's what we do here. It's great. Yep. CNO is super.
Thank you, sir.
Thank you.
So what do you guys think of CNO3?
Well, one, I get to hang out with Robert, which I've heard so much about and had a chance to talk with and learn so much from. Spending time with Nick and all the students, just amazing time. I think it's given me perspective. I kind of get stuck in my own little world, so it's nice to see, you know, what else is going on. And even though I did some teaching, I learned so much. So it's been a wonderful experience and kind of recommend it.
Robert, how about you?
Well, I feel the same way. The group and the level of information was just eye-opening for all of us, I think. And that's information we don't usually learn. And we had both your input, Dr. Yiannios' input, and Ed's input, which was really fascinating to see the real information from someone who does it every day. You know, it was really fantastic curriculum.
Do you recommend it for others?
Yeah, I mean, I think any dentist who wants to deal with head and neck issues has to learn more about the bigger picture, and that's what the essence of this is.
I'm going to go so far as to say I think any dentist that deals with the head has to learn this stuff. Yeah. Is that fair?
That's correct.
Yeah, man, because it has to do with everything we do.
Well, we certainly cross paths with it on a daily basis, even though we don't know that. Yeah. Right? It's all hidden away under the skin, and we hear the problems from the patient, but we can't see them all. And without the imaging, without the expertise, we wouldn't be able to detect what's really going on.
Yeah. Absolutely.
We've got to measure, because measured matters, right?
Yes, of course.
Later, guys.
Right. Thanks, Nick.
Thanks, man.
All right.
Okay, hugs, damn it.
Thank you.
All right.
You know, my experience at CNO3 was pretty amazing. There was a great dynamic of a lot of different people that really know their stuff, from, you know, the oral surgery perspective to, you know, Dr. Nick from the general dentist perspective, making it all work from that avenue, which is something you usually don't get. You usually are just kind of stuck, you know, learning this, and you're like, how do I apply that to my practice? So it's really great to hear that from a general perspective. But this course really answers a lot of questions that you won't get answered anywhere else, you know, like especially like how to look at the TMJ and diagnose it, and especially from an MRI perspective. I don't know another course out there, and I've looked pretty hard to find something that looks at MRIs and really gives you a standpoint of, you know, what do I do with that? I mean, most people don't even know how to order an MRI, let alone what to do with it when you get it. And there's a lot of people out there with this problem, and there's a lot of need in every community for somebody that can do that. So it's a pretty cool course.
I'm from Japan. I'm general dentistry, Kenju-Natori. So last year, I came to here for CNO1, and this time, so CNO3. So honestly, so my brain is so very tired. So because there is a lot of so information and so a lot of confused. So but now I performed so a little detailed therapy so in my clinic. So but I try to do my best next future. So Dr. Nick told me so CNO4 and the CNO5 I'm looking forward to. So come here. Thank you very much. Major matter Japanese is so Japanese. Japanese is a measured is hakaru. Hakaru is Japanese. Measured matters mondai. So mondai is meaning is problem. Yes. Yeah. Okay. Mondai o hakaru. So Japanese. So it's so.
Hi, my name is Alev Solak. I am coming from Turkey. I am an orthodontist. Actually, how I ended up coming here, last year I came to CNO1. It was an amazing course. And now I came to the CNO3. What I learned here, I learned to evaluate the MRIs, the CBCTs, which on a regular basis I started taking CBCTs from my patients maybe in the last 6-7 years. But I never checked on my practice, very rarely MRIs, and I cannot get the quality that you achieve here. But it was nice to understand what you evaluate, all these steps, T1, T2, steer, PD. And it was an amazing course for me, so in order to detect the problematic cases which we cannot help sometimes. And I started to apply the TEC scan, JVA, and EMG technology in my clinic. It will be in benefit of my patients because I will measure mostly everything, especially from JVA. I can find out if there is any dearrangements happening in the joint, which will be of benefit for me. I don't want to have any surprises in my practice, and I want to have, how can I say, predictable results. I don't want to start a case, in the end ending up with resorbing joints and then having problems. And I want to inform this to my patients. I was doing it on a regular basis, but not in such a detail because I didn't have the technology. After I saw the videos of Dr. Nick in internet, I gave a decision to finish this course and to right away apply it in my clinic. I'm very happy. The hospitality here was amazing. I met amazing people at Zebovitz, John Radke, Brent Thompson. These are all amazing guys. Especially Brent, I was having problem with the equipment. He was all the time connecting online from internet. Sometimes I was calling him 3 p.m. in Turkey. It was 5 something and he was again answering. I was understanding from his voice that he was just getting up. But again, he didn't bother. He was trying to help me whenever he can. I want to thank Brent from deep of my heart and also John Radke because they taught me how to evaluate the EMG and JVA, and this is amazing for me. I didn't expect to meet them here, and it was very nice thought of Dr. Nick to call many specialists in this area, and we had a good interaction in those 3 days. I'm very happy, and it was really nice. And it will be of benefit for all of my patients, what I got here. Thank you.
I'm John Radke, and I'm the chairman of Bioresearch Associates, Inc. in Milwaukee, Wisconsin. We manufacture instrumentation for diagnostic purposes, for dental diagnosis, and to analyze masticatory function. I really enjoyed the the interactive nature of this course with, participating with a number of very knowledgeable people in different areas, and then the interaction between the various speakers and so on, I thought was really excellent, and between the attendees, asking questions and so on. So that's probably the thing I enjoyed the most about the course. There is so much to learn, and even after 72 years, I realize I still have more. I can still learn, and so that's always a pleasure. And I hope to come back and participate maybe a little bit in the future, and you look forward to it.